we've recommended a penile implant for you as a treatment option, then usually you have failed oral therapies, meaning the pills are not getting you as hard as you want to be for as long as you want to be, and we think the implant will be the most reliable, consistent thing to get you back to having your own sex life back again. During the procedure, the anesthesia doctors will put you to sleep. We shave and prep the area very thoroughly, and then we make a small incision and place the 2 cylinders inside the penis. We do that after measuring your own penis and making sure we get the best girth and length for you specifically. We place in the other components as well, and then we close up the area. And when you wake up, you'll have a small drain, as there's a tube coming out that helps keep the fluid out of the area, as well as a catheter inside your bladder that goes in once you're already asleep. I have my patients stay in the hospital for 1 night, just so that they can get some antibiotics in the IV overnight. Prior to the procedure, we have you meet with the anesthesia doctors who check blood work and make sure that you're safe for anesthesia. If you have certain medical conditions, like heart conditions, or if you've had a transplant, then we have you meet with those doctors as well to make sure that you're safe for surgery and optimize whatever we can to make sure you have the best surgery possible. You will need to arrange for transportation because you will need a ride home the day after the procedure. You'll be taking pain medicines or narcotic pain medicines, so you will not be able to drive yourself. Prior to your procedure, you will be given a special soap to wash with the day before the procedure. In addition, we like you to tell us if you notice any sort of rashes or any signs of infection. Prior to your procedure, we'll review all of your medications, both myself as well as the anesthesia doctors, and we may have you stop some medications, specifically blood thinners such as aspirin, Plavix, or Coumadin. Of course, this will be done in conjunction with your regular doctors who prescribe those medicines to make sure it's safe for you to stop them. The anesthesia doctors will review the specifics of these instructions, but we don't want you eating or drinking anything after midnight the day before your surgery. For the day of surgery, mainly to go home with the day after surgery, we do recommend bringing some loose pants or sweatpants to wear so you're comfortable going home. If you feel comfortable shaving the area prior to the procedure, that's completely fine and you can go ahead and do that. If not, we certainly can do it after your sleep as well. That's not a problem. The day of surgery, you'll get checked into the registration area and then brought to the pre-operative area prior to the procedure. The nurses will get you all set up, go through your history, and have you answer a bunch of questions, and you'll have an IV place to start your antibiotics. I personally examine every patient in the pre-operative area to make sure there's no signs of infection or a rash, and if there is some sort of infection or rash, then sometimes we'll cancel the morning of the procedure because we want to do it in the best conditions possible. First of all, I would ask that you not be nervous about this procedure. We're going to take great care of you, and we've got a very experienced team that does this routinely. That being said, if you are nervous, please let us know or let the anesthesia doctors know. Sometimes they can give you a little bit of medicine in the preoperative area to ease your nerves. We'll give you the number for our office. If you have any sorts of questions or concerns, please do not hesitate to reach out. I want to make sure every single one of your questions is answered before the procedure.